Hey y'all, welcome back to Abby and Shelby RN. Today we are going to be talking about hypoxia, which is a fundamental topic in nursing. I really would love to do an entire series about oxygenation, but to start, hypoxia is a great place. If you're working in the hospital or you're a nursing student, you will absolutely come in contact with someone who is experiencing hypoxia, and it's so important to be able to know what to do, how to identify it, and how to fix it if you do have a patient who is becoming hypoxic. So in order to understand how to identify hypoxia in your patient and choose interventions to help your patient who is hypoxic, you need to understand what hypoxia is. So in a nutshell, hypoxia is basically lack of oxygen getting to your cells or inability of your cells to properly use that oxygen. So this can happen from a lot of different reasons. So you could have a lack of hemoglobin or oxygen carrying capacity of the blood. You could have a patient who has pneumonia, so there's a diffusion issue. You could have a patient who maybe has chest trauma, and that is impairing proper ventilation of oxygen and carbon dioxide in the body. You can also have a patient who is in hypovolemic shock, meaning that they just don't have enough blood in their body to properly deliver oxygen to the tissues. So in some way, some form or another, that oxygen is not able to properly perfuse your tissues, and so your tissues are not receiving oxygenation. And this is a huge issue. So when we talk about signs and symptoms of hypoxia, you have early signs and symptoms and you have late signs and symptoms. So early signs and symptoms are always going to be your change in level of consciousness. So I always think about this in the hospital. The first thing I notice in a patient who is not receiving enough oxygen is they become extremely restless. They are fidgety, jumping out the bed, they're apprehensive, they become very, very anxious, and they just cannot sit still. So this is going to be some of your first signs. You can also notice it in your vital signs as well. So if you notice that, something's going wrong, check those vital signs. You're going to have an increase in heart rate. Early on, you'll have an increase in blood pressure, and you'll also have an increase in respirations because that person is going to start hyperventilating, trying to pull oxygen in so that it can perfuse the rest of the body. But just because they're breathing in more oxygen does not mean that the problem is fixed, because it could be a perfusion problem. It could be a diffusion problem. So that doesn't necessarily mean it's going to fix the issue, but this will be noticeable in their vital signs. So once you notice that kind of these early changes are happening, you need to start implementations immediately. But I will tell you, a lot of people talk about central cyanosis, which is that blue colored lips, bluish colors in the mucous membranes, things like that. This is a late sign of hypoxia. So this is not when you want to catch that your patient is hypoxic. We want to catch it as early on as possible. So if you notice that your patient is having a hypoxic episode, let's talk about some of the interventions that you can do almost immediately and that are very, very effective, even though they sound very simple. So I always talk about with hypoxia or oxygenation, positioning it's everything. It's the first thing you're gonna do, and honestly, 80% of the time it's gonna fix your problem. So you wanna sit that patient's head of the bed up to a semi-Fowler's position, which is about 45 degrees, or a high Fowler's position. So sitting the patient up will allow their lungs to have better expansion, which will help with proper ventilation and hopefully will fix your hypoxic problem. Another positioning thing that a lot of people forget, but it was very, very useful in COVID patients, was prone positioning. This is great for lung expansion as well. You can also use your nasal cannulas or whatever oxygen delivery that person may have at their bedside. We can also do things like incentive spirometers that will help to the patient breathes in super deep, helps to expand their lungs, break up any consolidation in the bases. We can also do cough and deep breathe. So when we have a patient who needs to be kind of given a boost with that oxygenation aspect, positioning as well as ambulating, moving around, helping the patient not to just be in a sedentary position at all times. I mean, it makes a huge difference. Of course, we're gonna be kind of careful with the oxygen delivery that we're giving our COPD patients. We don't wanna give them super high concentrations of oxygen if we can help it. So positioning and things like that will be extremely useful in those patients with COPD. So once we kind of have implemented, those interventions, we can start to try to see if we are actually helping the problem or if we need to kind of go about another route with it. So definitely look at your patient. See, are they responding to these interventions, or do we need another game plan? And so hopefully it will be fixed early on, and you'll never have to experience a patient who turns blue, because it's absolutely terrifying when this does happen in real life. So I hope this was helpful, little kind of breakdown of hypoxia, and that you are better suited with some tools to use in nursing practice if you do experience or come in contact with a patient who becomes hypoxic. Thanks y'all, and I will see you next time.